Hi, I'm Lawrence Bergstrom, registered osteopath and non-surgical spinal disc specialist. In this video, I'm going to talk to you about a spinal condition called spondylolisthesis. I'm going to explain what it is, how they occur, and how they can be treated. So firstly, what is a spondylolisthesis? A spondylolisthesis is where one vertebrae slips forwards in relation to the vertebrae or the bone below and the one above. And we grade spondylolisthesis depending on how far one vertebrae or spinal bone moves in relation to the one below and the one above. And they're graded from grade 1 through to 5. Grade 1 is the least severe, which is less than 25% slippage of the body of this bone forwards in relation to the one below and the one above. And then as the percentages increase, the vertebrae slips further forwards, with a grade 5 being a complete dislocation of this bone in relation to the one below and the one above. Okay. Now, what causes spondylolisthesis? There are two primary causes. One is known as lytic and the other one is known as degenerative. So with a lytic spondylolisthesis, there is a fracture in the bone here in what we call the pars interarticularis, and it's an important part of the bone which is responsible for stabilizing this bone and keeping it in place. And when you have a fracture there, the two parts of the bone separate and then it will move forwards. And then the second type, the degenerative type, is related to, as the name suggests, a degree of degeneration. So as time goes on, with load on the spine, poor posture and so on, we get more and more load on the bone, on the joint, and subsequently it starts to move forwards. Now, the fracture type, or the lytic type, is more common in young athletes and across a broad range of disciplines. So sprinters, butterfly swimmers, young athletes that are doing heavy squats, heavy deadlifting, cricketers which are really extending their back as they're then bowling the ball. These kinds of things can cause massive strain on the low back, and then as a consequence, back pain and possibly leg pain. Now, it's known typically orthopedically and within the manual therapies, the physical therapies, as being quite hard to treat, because if we think about this, it's a mechanical anomaly. Okay, you've got an alteration in the position of the bone. So whether you're an osteopath, a chiropractor, a physiotherapist, or an orthopedic consultant, we know that it's one of the more difficult conditions. Now, one of the good things is that if it's a grade 1 or a grade 2, generally this can be managed through specific exercise, a particular exercise regime, and in the system of care that we use a targeted form of non-surgical spinal decompression. If it becomes more severe, certainly once we get beyond grade 3, you're a surgical opinion. So you're going to meet with a surgeon, and the surgeon is going to likely want to fuse this area to stop it moving further forwards. Because if it moves too far forwards, you're going to have problems because the nerves are going to be compressed and quite possibly your spinal cord, which is undoubtedly very serious. So grade 1, grade 2, we have quite a lot of success with keeping people active. They may still have some low grade back ache, but they're not going to have the severe pain that perhaps when they first came to see us. Okay. How do you know if you've got a spondylolisthesis? Well, there's something we call an extension catch. Now, often people will describe a spondylolisthesis without knowing they have one. So they'll bend forwards, they'll rest their hands on their thighs, or they'll lean forwards on a supermarket trolley, or they'll put their hands on a railing and they'll push their bottom backwards, something like that. Or they'll lie on their back and they'll hug their knees up to the chest, and they find that very relieving. Now, typically what tends to happen with a spondylolisthesis, if you're standing for any length of time in one spot and you're not moving anywhere, you're going to get persistent low back pain, and it can become severe. And if it worsens sufficiently, if we go back to that scenario where one bone is moving forwards in relation to the one above, one above and one below, it's going to cause compression on the nerves, and then you're going to feel some pain maybe in your buttocks and the backs of your thighs, your calves and your feet. Okay, so the extension catch is where you bend forwards, and that feels quite relieving. And then as you go to stand up, there's this point where you have to get through that pain to then be able to stand fully upright again. But it'll happen again and again and again. Every time you sit down and then you go to stand up again, you think, here it comes again. Now, it also depends on how stable this joint is, because if it's very unstable, every time you move, it's moving, and then it's putting more strain on these structures, potentially more strain on the nerves, and these joints at the rear here that we call facet joints. Okay, so if it's very unstable, then you're going to need a surgical opinion. But grades 1, grades 2, we can do a lot to help with. So, if you feel that sounds like me, every time I bend forwards, it feels really comfortable. And as I go to stand back up again, I'm getting this sort of sharp pain. If you're standing for a long period of time and your back's just getting more and more painful, it's possible that you have a spondylolisthesis. Now, how do we know if you have one? Very simple. Two techniques to find out: a plain X-ray, so we can assess the positioning, or an MRI. The MRI gives us more information because we can assess the positioning, but we can also see the health of the disc in between, the intervertebral disc, this spongy donut in the middle, and also if there are any nerves compressed as well. So the MRI is the preferred choice. The X-ray gives us some degree of information, and the MRI will tell us the rest. So that gives you a good understanding of what a spondylolisthesis is. It is, if it's low grade, grades 1 and 2, it's largely manageable without a surgical intervention. Certainly once it gets to grade 3 onwards, you're going to require an orthopedic assessment. You may also need a dynamic X-ray to actually look at the movement here, because if that's moving around an awful lot, even with your core stability exercises, the system that we use to help decompress that area, it's not going to be enough to stabilize that. So grades 1 and 2, we can help you. Grades 3 onwards, then we would refer you for an orthopedic opinion. So I hope this video has been helpful. Thank you for watching.